Risk factors for BV is multiple sex partners, female partners, new partners, lack of condom use, douching, HSV, 2, and STD. When you have BV, bacterial vaginosis, it increases your chances of getting STDs and STIs. Although BV is associated with bacteria, it can be identified on the male genitalia as well. Treatment for male, which is what I just said, is not supported at this time. And among women that have sex with other women, so women that have sex with other women, you have a high level of BV in that population as well. And that's because their female partners most likely is having sexual activity with a male person or male partner. So tub bathing, so like bathtubs, people that like to take baths, that also puts you at the risk with bubble bath and all those stuff women love to do. That unfortunately increases your risk for BV, bacterial vaginosis. And IUD insertion, believe it or not. So depending on the sterile environment and placing that, you can also expose the woman to having symptoms. STDs, you already know about that. What are the signs and symptoms for BV? The typical symptoms that we're all aware of is that fish odor, right? Mildly to moderate increased vaginal discharge, vulvar irritation, which is less common but it's there, dysuria, dyspareunia, so pain with sexual encounter, you want to dig further and maybe run some tests and see why that is happening. Risk factors also predispose patients to BV, recent antibiotic use, decreased estrogen, so for our older female population, right? When they go into menopause, this is also a concern for them. And physical exam. When your patient come in and asks, give you their symptoms, what do? Of course, you want to do your vitals, you want to get more history as far as the presenting symptoms, to be able to isolate, or narrow down your diagnosis. There are other several differentials that we have that can also fall into the same or have the same similar symptoms. So you want to do put on a slide, do your slide with your microscope, see if you find your G cells on there. And you also, right now we do have the monocular testing, which is also a very accurate testing that isolates to the T the specific bacteria that is causing that symptoms. Because most times women come in and they say, like this my specific patient, she said, according to her, I've been having this problem for years and my diagnosis have always been BV. And I'm giving metronidazole, right? So you get those situations, but the question is it actually BV that they have? For the fact that they have the discharge, what they think was Mardora's odor, some people call it fishy odor, does not necessarily mean that person has BV. You still have to do your test, right? Do your swab, or you can do, right now we have like the quick test, like the POCT test for BV. You do it right there in your office, you get a result like in five minutes, right? Right there, I do it in my office all the time. So it tells you right there whether this patient actually has BV or not. But that test, just like your other POCT test, like your strep or whatever, it's not 100% accurate, right? It still have that margin of error. So if I have a patient with a chronic situation like this, I'm not even gonna do that test for them. Because now I'm trying to know why they keep having this problem. So I'm gonna run that culture. I'm gonna do the molecular testing for this patient, and which is what I did for my case study patient. So let's talk about the differentials. What are those differentials? Other diagnoses that fall into the same type of symptoms. Candidiasis, sinusitis, chlamydia, gonorrhea, herpes, trichomonas, vaginitis, cellulitis, and also balanophthitis. This is for the men, specifically for the men. All right, lab result. We did send the molecular testing for this lady. Her result came back. We had a telehealth about her result, and guess what she had? Strep B, pneumococcal. She didn't have BV. So I gave her, put her on penicillin twice a day for 10 days. That's it. I haven't seen her again.